on this day, the 4th of February, that we are marking the Cancer Day. Mr. Speaker, for us to just understand cancer in its simplest of terms, we have to imagine the cells in our body. The normal cells now begin to behave abnormally or start growing abnormally without any specific known cause. And most often, when the sickness starts, it starts like any other disease. It can just start like your stomach is paining you. It can just start like your hand is paining you. Or you can just see a swell, a very small swell anywhere of the body. And initially, some of them are benign, that is, they are not dangerous. We can remove them and they will not come again. Those swells. But with the stomach pains, we can just think that it is some of these simple sicknesses like gastritis or, any pain. It could be in the testicles, it could be in the breast, and a swell in the breast, inflammatory processes that are taking place. But we treat them and they reoccur, they are not going. Then suddenly we might see the person start to lose weight. The weight, he's losing weight without any reason. Because the pain that the person is having is not that much to explain the weight loss. Indeed, in the medical school that I attended, they say that if you send a patient away 3 times and he comes back complaining about the same complaints, etc., start thinking of something different. And so you might have to start thinking of what? Cancer, and ask the person to go for the necessary laboratories. It can be at any part of your body. It can be in your brain, your face, any part of your body. There can be a swell in the brain or some changes in the brain. The cells are abnormal. So you send a person for a specific laboratory depending upon the location that you suspect it is. And, right, Honorable Speaker, the issue here is that the laboratories are so expensive. If you take any investigation of that part of the body that you finally use to diagnose cancer, the laboratories are so expensive. If this is the brain, you finally have to end up doing CT scan. The X-rays will only tell you that there's something wrong, but it will not give you a lot of information. And when it comes to the treatment too, quite expensive. We use drugs and sometimes follow it up with radiation. Sometimes we've got to do a surgical operation to try to remove whatever is there. If there is no spread of the disease, that is what in the hospital we say metastasis. If there's no spread, sometimes surgically you can limit it, remove whatever it is there, and then you can control it. Follow it with radiation or the drugs. Already a spread of the disease. So that if you remove it from one end, it is still located at another end, and it will still continue to damage the person. In men, the prostate cancer is quite common. And we all know how it starts. Problems with urination, until you cannot urinate, until you have to go for surgery. And after the surgery, you might have to continue with drugs or radiation. With the women, The commonest that we almost often encounter here is the breast cancer. I know that with the breast cancer, there's good work being done. There is an NGO that is doing very good work in terms of looking for resources. But I must say that as a country, at the stage that we have reached, where we are maturing more, in other words, we are dying at an older age, we are surviving more, the average life expectancy is increasing. We should expect more cases of what? Cancer. And so it is high time that we look for a very good cancer fund, a rare cancer fund, that will have people who have got cancer to be able to access treatment. Or else, we will continue to diagnose them, we will continue to do all that we want to do. But if we don't get the money, we are not going to save a lot of people in this country. And so I appeal to Parliament, and all of us, to use our good offices to advocate for I know there might be a cancer fund in this country now. I'm not very sure how much is usually in it. But we should take an interest as a nation to establish a good cancer fund that will contain a lot of resources, a lot of money to assist our people with cancer. Most often, what happens is that people wait. When they have it and it is advanced, you will see them on television showing whatever they have and advertising for assistance. That is good, but it is not enough. The amount of money that is needed is usually very, very high, either for the operation, for post-operative treatment, for the drugs, for the radiation treatment, etc. So I appeal to all of us. Let's take a second look at this cancer fund and work to ensure that we grow it for the nation. I thank you, Mr. Speaker.
Thank you very much, Mr. Speaker. Mr. Speaker, I rise to support the statement made by my honorable colleague from Suhum on cancer. Mr. Speaker, it's important for all of us to appreciate that the NPP government somewhere last year, as part of the National Health Insurance Program, adopted Herceptin, one of the most expensive drugs used in treating cancer, on the National Health Insurance. Today, anybody who is suffering from cancer is able to use this drug at no cost. And it's important for us to appreciate that. Mr. Speaker, I would want to bring the attention of the House to a very important point my colleague made with respect to alcohol. It's important for us to appreciate that today in our country, we are seeing the gradual usage or the gradual rise of unapproved alcohol by young men. Today, when you go to most pubs, despite the fact that we have COVID, which is preventing a lot of pubs, we will know that they are still in operation. Young people or young men and women are today drinking alcohols that are unapproved by the FDA. And I think that this has a long way in contributing to what I call the rise in cancer. And it's important that we call on the Food and Drugs Authority to crack down on these unapproved alcohols. Mr. Speaker, it's also important for me to appreciate that as men, or men in this country, it's important for us also to contribute in detecting cancer at the early stages. We all know, we've heard from the radio, through education, on how we are able to detect breast cancer amongst our women. And I'm using this medium to urge our men to, as it were, check from their wives, and if possible, their partners or spouses. Early morning when they wake up, it's important for us to check if indeed we've seen some unusual growth in their breast. It's important to bring to the attention of our women to seek early medical attention. I rise to support the medical. Thank you very much. very much for the opportunity.
Thank you very much, Right Honorable Speaker. I also rise to contribute to the statement made by the Honorable Member on this day dedicated to cancer. And he rightly elaborated on the importance, the relevance of cancer as part of the non-communicable diseases that we talk about. And Mr. Speaker, he listed a number of them that are common, especially in this country, be they the childhood cancers, cervical cancer, breast cancer, prostate cancer, skin cancer, a number of them. But these are what are common in our country, but it doesn't mean that these are the only cancers that are affecting us. And Mr. Speaker, that really makes the health situation in this country, in Africa, very complex, because it's, you know, it compounds and makes the situation complex, where we haven't finished dealing with infectious diseases. We are confronted with the cancers that we thought are diseases for the elderly. Everybody thought that when you grow old, then you get cancer, but that is not the situation. So we are battling with infectious diseases and non-communicable diseases. And that is complex, and it increases expenditure of the country on treating us. Mr. Speaker, he has given the statistics and a lot that I wouldn't want to repeat, but the reality is that many people are dying from cancer. And even sometimes the statistics that we quote are just what we know. And basically those coming from Konfanoche Teaching Hospital, the Kolebu Teaching Hospital, you know, maybe the regional hospitals. That's what we know. The rest in the rural hinterlands are dying even without knowing that they are dying from cancers, because they don't even know. And like the maker of the statement stated, many of them report late, at a time that little can be done, you know, for this patient to survive. And one thing about cancers is that, and for that matter, non-communicable diseases, see, they kill slowly. Because it's not like the infectious disease like, you know, coronavirus or whatever that you get and you go very fast. This one, the progression sometimes is very slow. And because of that, the patient himself or herself thinks that, oh, it is not a serious condition, I can cope, until prevention is better than cure. Cancer treatment is expensive. So what we need to do is look at how do we modify the risk factors that you listed. Alcohol intake, smoking, you know, dietary factors. How do we modify these factors so that they don't become factors that will expose us to developing cancer? And, you know, alcohol, whether approved or not approved, is alcohol. So just avoid it if you can, or minimize the intake if you cannot. Smoking is just like they're taking alcohol. Avoid smoking it doesn't give value to you. And Mr. Speaker, sometimes what baffles me is that, you see, on the latter note, there are about 3 things that men do. If you find him drinking, he's likely to be smoking. And if he drinks and smoke, he's likely to do the other things. Compounding, factors that will make him predisposed to cancer. And therefore, Mr. Speaker, in conclusion, I just want to support the maker of the statement to say that as a country, we have to invest, in cancer care. I know the Ministry of Health has a policy, on cancer care. The challenge is inadequate funding. And therefore, as a country, we have to really that we dedicate enough funds in cancer care, like my colleague suggested, of the cancer fund, and also invest in research. Because like I said, what we talk about are just the institutional figures that we get, but we can get more, the burden, we can get more burden by investing in research and ensuring that we have adequate data, by also establishing just a simple register that, wherever a cancer patient is discovered, is taken, so that as a country, we will have enough and accurate data on cancer that we can all refer and talk about. And lastly, to add to the public education, like we are doing, so that our populace can be enlightened about the symptoms and signs of whichever cancer, so that they can report early for early treatment. Thank you, Mr. Speaker.
Yes, no member for shares. Sorry, thank you very much. I would like to commend my colleague for the work that he's done on one of the most confronting issues in our country today. Some of us have had friends who died out of this disease. I have one of which, or whose funeral I attended. And it's really increasing in our country today. Probably, I don't have the statistics, I haven't done any scientific research on that. But then, it happens in our communities, in our constituencies, in our regions. My issue is that most of the factors that they have stated, I think if others will bear with me, are quite presumptive. They still remain primary testing. The world has not conducted, to the best of my knowledge, Mr. Speaker, any litmus test that can let us develop approach that we can be 100% sure that our level of confidence in terms of tackling this disease can be done. And some of the factors, yes, for instance, like alcohol. If you look at the countries in the world where, in terms of standardized rate per 100,000 as they use, countries such as Australia, New Zealand, Ireland, and others, whose rates are high, you realize that in terms of even alcohol intake and the food they eat, and some of the food they have recommended or they have spoken against, they are not widely used in these areas. You come to countries such as Syria, where even in terms of population size, or even countries such as Japan, you realize that they have low rates. So I think as of now, we still don't have any confirmatory test from which we can draw the needed inferences and work along that critical path. I would like to say that as a country, one of the challenges that I have noticed we have is our inability to develop strategic management models for situations such as this. For instance, the factors my brother has stated, yes, we agree to some extent. What are we doing to do further work as a country? Sometimes we want to sit down because we are developing the economy. So we want to wait for probably a bigger economy, a developed economy, a science state somewhere. But I think we are so much blessed in terms of skill component of our labor force, especially in the area of health, that I think we can go further to find out all these factors, to what extent in terms of probably long term, in terms of severity, or in terms of level of integration, that they affect or they impact or increase or decrease cancers as dependent variables. I think we need to spend more in the area of research and development as a country in the area of health, so that we can, one day the world will wake up and they're like, oh, Ghana, we have been able to come out with confirmatory tests and reference will have to follow. So I would like us as a house possibly to encourage stakeholders and executives and policy framers and support what my brother has raised and make sure that we begin a comprehensive work on this. This is all that I want to say. Thank you, Mr. Speaker.
Do the leaders want to make any comment? Very well, thank you. That brings us to the end of statement time. Unless there are any announcements by the leaders, I will bring the proceedings to a close. Yes.
Mr. Speaker, we are in your able hands. Except Mr. Speaker has some announcement to give after this labor. Mr. Speaker, there must be refreshment after labor, for which purpose you have the sole right to determine. So, Mr. Speaker, we are in your hands. Refreshment after labor.
Yes, available minority leader.
Mr. Speaker, I will also like to support my colleague, the Deputy Majority Leader, that we are in your hands. And I also associate with all the additional requests. All in your hands, Mr. Speaker.
Very well. All matters relating to refreshment are deferred. The House is adjourned till Friday, 5th February 2021 at 10 o'clock in the forenoon. Friday, 10 o'clock in the forenoon. Thank you.